He has been published in various journals, including the American Journal of Otolaryngology and Journal of Otology and Neurotology. In his spare time, Dr. Prueter enjoys spending time with his family and wilderness, hiking, and biking adventures. With that, I will go ahead and turn it over to Dr. Prueter. Thank you.
Thank you, Terry. Good morning, everyone. All right, let's see how my screen sharing goes here. All right. What are you seeing?
Yes, we see the presentation, and I also see our members on the screen.
Okay, perfect. All right. So originally we were going to talk about hearing and what impact it has on the balance system, but I really felt that there are so many components to the balance system that I really couldn't specifically just talk about the hearing. So we're going to talk about all the different sensory components of our balance system and how that changes throughout our life, or how aging can affect that. So whenever we talk about a balance disorder, it's always really important to differentiate what somebody means when they say they're dizzy, because dizziness means a lot of different things to different people. And so it's important to recognize, what someone is describing. That way we can figure out what the underlying problem is. So we break it down in generally 4 different categories. And so vertigo is an illusion of motion. So these people describe that they feel like they're spinning, or the room is spinning around them. And this can be an inner ear or a brain problem. The other thing is you can experience syncope, which generally is not an inner ear problem at all. Syncope is a condition where people feel like lightheaded. They kind of feel like they're going to pass out. And typically this is more of a blood flow problem. The other thing to consider is something called disequilibrium. So this is a sensation like people just feel out of balance. They don't have vertigo. They don't feel like they have the illusion of motion. And they don't feel like they're going to pass out. They just feel off balance, and we'll explain more what that means. And then, of course, the last thing is kind of vague. Some people feel lightheadedness. They say that woozy or wonky or brain fog, and that's certainly not as severe as syncope, but oftentimes it just describes a lack of optimization of general health functions. So when we talk about the balance system, we again talk about multiple components of that balance system. So when we specifically say vestibular, that is the inner ear and the nerves that travel to that part of the brain. And so our vestibular system gives us the ability to balance, but of course have spatial awareness, and tolerate rotation, whether it's body movement or head motion, and then linear movement, so just walking forward or back. And then of course we need our visual system. So our inner ear and our eyes work directly together. And so I often tell patients that the purpose of our inner ear's balance system is actually to stabilize our eyes in our visual field. And so those systems are constantly working together. And then of course you have your feet touching the ground. And so if you have that lack of sensation, you certainly could have a significant detriment to your balance system. And then so you take these different sensory inputs, and by the way, it's not listed here, but hearing is included in that as well. So when we hear our surroundings, we have a better idea of what is around us, and certainly impacts our balance system. So when we talk about the vestibular and auditory system, you look at the different components. And so, of course, the external ear canal, the middle ear, that's part of our hearing system. But the inner ear is where we have our balance organ and our oh, are you guys seeing the wrong part of the screen here?
We're seeing your pre-save slides.
Yeah, let me.
You're not in display mode. Presentation mode.
Yeah, sorry about that.
Better.
There we go. Okay, so I was talking about our vestibular and our auditory system, and that is the inner ear. And so when we look at this diagram, can you see my mouse here?
Yes.
Okay, so this portion of the inner ear is our balance organs. And so we have 3 loop structures, and these sense our rotational movement. And then within this area right here, we have these structures that are known as the saccule and utricle. And these organs sense the motion of either vertical or horizontal motion. And so the reason why the balance and hearing system are integrated together is because they share a common fluid system. And so the fluid that fills the hearing organ is a similar fluid that fills the hearing system. And so oftentimes people with hearing and balance disorders could potentially be related. The other thing that is critically important to carrying out this function is, of course, our motor system. So if you have a good balance system, but you don't have the muscular strength to carry that out, oftentimes people will describe, a sensation of dizziness. Now, it's more than likely not an inner ear problem, but if they have muscular weakness, or if they have other like muscle and bone type problems, arthritis or chronic pain or things like that that prevent the balance system from functioning appropriately, oftentimes people can feel imbalanced, or they may describe dizziness or just weak. And so again, I want to emphasize the importance of the visual system. Remember, our vision and our balance system, our inner ear, is constantly working together. There's a constant push-pull mechanism. So as we turn our head one way, our eyes move the opposite way, and vice versa. And so that feedback from the visual system is critically important, and it can be affected by anything. So if you have corrective lenses that aren't appropriately fit, that's going to play an impact. If you have cataracts, even if you've had cataracts repaired, there's still a significant potential detriment in your vestibular system because of that manipulation that's been done. Now, of course, it's better that they've been fixed rather than have that cataract unrepaired. But nonetheless, having some sort of procedure can affect the balance system in a way. And so I previously mentioned the importance of our sensation. So the feeling not only of our feet touching the ground, but the feeling of each individual joint as we move about our system, about our environment. And so having an awareness, having that sensation of different types of services and different types of movements will certainly have a big impact on our balance system. And so as we age, we lose a lot of these mechanisms. I always tell patients that, when you were a kid, you loved to be tossed around and flipped around and upside down and merry-go-rounds and all that stuff. And as we age, we generally don't do that type of stuff on a regular basis. And so it's if you don't use it, you lose it kind of mechanism. And so, that has an impact on our balance system as a whole. But we also have to think about, that as we age, our brain, our neurons, aren't the same as they were a decade or 2 decades before. And, this is just a very simple picture of an MRI of somebody who is young versus somebody who's old. And you can just see the normal changes that can take place. But of course, there can be more significant changes, with people who have various neurologic problems. So when we talk about the specific inner ear causes of dizziness, as I mentioned previously, the ones that cause that illusion of motion, so that true sensation of vertigo, are generally just 4 different things. So the first one is this benign positional vertigo. And I'm sure everyone has heard about the crystals in your ear. So these crystals are part of those organs that I mentioned previously, the saccule and the utricle. And sometimes these little crystals, as you can see here, are in the wrong place. So they should be in this area here, and they float around in this canal here. And so when they float around, they cause typically a positional vertigo. So the most common thing is people lie down in bed and they feel the room spinning. It typically only lasts a few seconds. And the reason is because these crystals are just not in the right place. And so we do a very specific head maneuver, most commonly the Epley maneuver, that puts those crystals back into place. The other inner ear problem that people experience is one called Meniere's disease. And this is one where people get episodes of vertigo, but this vertigo can last multiple hours at a time. And they typically experience a fluctuation of their hearing, as well as ear fullness and pressure. And this is a condition that unfortunately is recurrent. It can last many years if it's not controlled well. The next one is something called vestibular neuritis. And this is a condition that is not recurrent. It's a single episode that comes on suddenly. And unfortunately, these patients are quite miserable. They're very, very severe vertigo that can last a day or two or until treatment is initiated. And oftentimes people go to the emergency room because they think they're having a stroke, but really it's just something called a vestibular neuritis, where you get inflammation of the balance nerve, and it's a very vegetative condition, but luckily it is short-lived, and luckily no real intervention is needed except for just supportive care. Why this happens is challenging. There are various theories, none of which have really been proven, but the good thing is it's not a recurrent condition, and most people recover just fine. If they have something called a labyrinthitis, that's the same type of condition, except it also affects their hearing. So they get that severe room spinning vertigo that can last all day or two, but they also have associated hearing loss. And so when we talk about again, dizziness, it's important that we differentiate between vertigo and imbalance. So in all of these conditions, the inner ear is being stimulated inappropriately, right? So when the inner ear is being stimulated, that causes vertigo. Now, if the inner ear is not functioning appropriately, we call that hypofunction, meaning it's not functioning to its full potential. And those people don't get vertigo, but they suffer from imbalance. So either the inner ear is being stimulated and you get the vertigo, or the inner ear is not working up to its full potential and you can have imbalance. And so sometimes it's not just an inner ear problem. It can also occur coming from the brain as well. So the most common phenomenon that is a combination of a brain and inner ear problem is something called vestibular migraine. And so oftentimes people hear of traditional migraine, which is a classic, pounding, throbbing headache, light sensitivity, nausea, and vomiting. Well, patients can also have this migraine affecting the vestibular or the balance system, and they have a similar presentation to like I described with Meniere's, except often their symptoms are inconsistent. So vestibular migraine patients can have various types of dizziness, so they can get true room spinning vertigo. They can have episodes of kind of this brain fog, lightheadedness, imbalance sensation. They can also get a lot of the ear symptoms. So it's confusing because it kind of includes everything, but that's kind of what makes the diagnosis easy, is because it doesn't really fit any particular pattern that was previously described. And then the other one is something called 3PD, or persistent perceptual postural dizziness. And this is a very challenging condition because it can develop after having any sort of inner ear problem, a history of benign positional vertigo or Meniere's or labyrinthitis or vestibular migraine. And the problem with this is that it can become a very chronic condition because people have or will develop almost a fear of developing that dizziness, and that fear, chronically is fatiguing and can certainly prevent people from carrying out normal daily activities, and it is generally not a structural or there's no objective test that can determine this. People have this insult to their inner ear, and they just have a really hard and slow recovery process. And the challenge is that sometimes people get better just with rehabilitation, but sometimes people need some medications to help kind of get them over that hump. So, excluding the typical vestibular conditions,